Hello, my name's Carole. I'm a psychosexual therapist working for Share Psychosexual Service, employed by Blackpool Teaching Hospitals Trust. This is a short video for anybody who is considering making a referral into our specialist service. Share stands for Sexual Help, not Health, and Relationship Enhancement, and we see individuals and couples who may be experiencing difficulties with sexual function, relationship, or issues around sexuality, gender, or sexual practices that may be concerning them. Share is a dedicated service for sexual disorder. We are a team of 9 psychosexual therapists who have all got a qualification in psychosexual therapy. In addition, we have a dedicated administration team of 4, and we also provide the largest clinical placement for trainees who are studying psychosexual therapy at the University of Central Lancashire. Apart from working under the policies, procedures and governance of Blackpool Teaching Hospitals Trust, the psychosexual therapists within the team also work under the procedures and ethical guidance of the College of Sex and Relationship Therapists, otherwise known as COSRT, C-O-S-R-T. The service is commissioned by Lancashire County Council and Blackpool Council, and therefore we receive referrals from any residents living within the geographical boundaries of Lancashire and Blackpool. On occasions and in special circumstances, we will receive referrals from outside our geographical area if there is a service level agreement made between the CCG and Blackpool Teaching Hospitals Trust. This is done on a case-by-case basis and very much depends on our current waiting times and demand for the service locally. We provide services across Lancashire and Blackpool from 8 sites in Lancashire and 1 site in Blackpool. Our therapists work from the west, east, 2 sites in the central area, 1 in Hyndburn and Ribble Valley and 1 in Blackpool. And in addition, we work right up to the top in Lancaster, where we provide 2 days therapy a week. We are commissioned as an adult service, thereby receiving referrals and seeing clients from the age of 18 to no upper age limit. Indeed, our oldest client in the service has been 89 years old. We do, in certain circumstances, see young people between the ages of 16 and 18. For example, this might be a young person who is having gender identity issues at the age of 16 and 17, who may need some support being referred into a special gender identity service before hitting the age of 18, whereby they would be on a long waiting list to be seen as an adult. In addition, we may see young people who have non-complex psychological difficulties, i.e. young people who perhaps have not got mental health issues or suffered from abuse or trauma in childhood, who might just want a little bit of additional support as they start their journey into being a sexual person. Predominantly, referrals are made into the service by GPs. However, we receive referrals from a number of agencies, including primary and secondary care, nursing staff, mental health teams, social services, and also from spiritual leaders. We receive referrals from professional organisations, but also we welcome referrals from our volunteer sector. Conditions and difficulties that would make an appropriate referral into the service would include sexual difficulties or disorders of sexual function. In that, I would give examples for men as erectile difficulties, ejaculatory difficulties, difficulties around sexual drive and desire. And for women, I would include our core conditions being desire, arousal, interest issues, genital pelvic pain penetration disorders, and issues around orgasm. In addition, we will see service users who are having difficulty about their sexual orientation or gender identity, or they may be concerned about their drive and their sexual activity at this current time. This may include increase in risk-taking behaviours that may be concerning the service user. We are not a forensic sexology service. If there is anybody who presents to you who is currently offending in a sexual nature, it would be a forensic sexology team that you would need to make the referral to. Also, when we address childhood sexual abuse or sexual trauma with our service users, it has to be noted that we're not a dedicated service to deal with this per se. And if the service user hasn't had an opportunity to explore these issues in more depth before coming into the psychosexual service, it may well be that we make an onward referral for them to address those issues first and then come back to us so that they can address the sexual disorder that they're currently experiencing. It is important to note that we do not take self-referrals for Share Psychosexual service. You'll be supported in making a referral if you're required to do so, and if you send a referral in that is inadequate for our needs, we will contact you again just to ascertain further details before we list the client to be seen. To aid you making a referral, we do have a specified service pro forma for the referral to be made. This will act as an aid memoir for you as a professional and gives you an idea of exactly what information we require before seeing your service user. If there is some information on the service referral pro forma that you don't know, please just identify that as not known. This is really important, and then we don't feel that the information has just been omitted and that actually that is information that you're not privy to. Please make sure when you're referring a client in that actually the client wants to be referred into a sex and relationship service. We do sometimes receive referrals, and when we contact the client, they have either no idea that they've been referred to us or actually don't engage with us from the outset. And this in a way is a wasted referral, both for you as a referrer, but also it raises anxiety for those people who we are trying to make contact with. The service pro forma gathers that essential information that we need. Some of the information that I'm going to suggest to you now is really important to protect your service user as they enter into the service. If, for example, you're referring an individual into the service who has a partner at home, but the partner is unaware that there is a sexual difficulty occurring, what we need to know is whether or not we can write out to that service user. And it's really important that you gather information about correspondence preference that you can put on the referral form so that we don't in any way compromise somebody who's at home with a partner, as there may be significant relationship difficulties occurring at the time, and indeed there could also be domestic violence and abuse. Please make sure therefore that you clearly write down correspondence preference, and whether that's by letter or by phone. If it's phone contact only, please make sure that you put the accurate telephone number on the form and that you check this with the service user prior to sending the referral in. If you are dealing with somebody with gender identity issues, please make sure that you note on the form their preferred name on the envelope, because again, we would not want to compromise anybody who is living in a family who may be not out to that family around their gender identity issues at that time. It is really important that you identify on the referral pro forma any risk that your service user may pose. That can be a risk to themselves, to others, to the wider community, or indeed to the sex and relationship psychotherapist that they will be seeing for therapy. Please note this very clearly on the referral pro forma. If we have any queries, the service will get back to you. Once we receive the referral, you will receive an acknowledgement that we've received and also an idea of the current waiting time in the geographical area that that client lives in. At the end of therapy, you will be notified of how often the client's been seen, their outcomes of therapy and their service satisfaction whilst they've been with us. If you are uncertain in any way about a referral, please ring and speak to us. If you just want a specialist assessment, we're happy to do that as long as that's specified, and we will support you signposting or making referral to more appropriate services. I hope you found this video useful. There is on the useful links a leaflet for referrers and also an example of our referral pro forma for you to download and use. If you've got any further questions, please contact the service office. Thank you.